It was in Standing and Finance Committee, and to that we shall revert. And to that we shall revert.
This Honourable House is now in Standing Finance Committee. Honourable Member for St. Michael North.
Mr. Chairman, I crave your indulgence and permission to allow the Honourable Member from the other House, Minister of Health, to join us in duel to present the estimates.
Permission granted.
Mr. Chairman, Head 86, Ministry of Health and Wellness, in the amount of $236,347,534.
Honourable Minister, you have 10 minutes to give your overview of the ministry.
Good morning, Mr. Chairman, and all honourable members of Parliament. This morning, I'm accompanied by a number of members of staff. To my immediate left is the Permanent Secretary, Mr. Wayne Marshall, the Chief Medical Officer, Dr. Kenneth George, Dr. Arthur Phillips, the Deputy Permanent Secretary, Mr. Wayne Webster, the Director of Planning and Research Unit, Mrs. Rashima Cheltenham-Niles, the Chairman of the Board of Directors of the Queen Elizabeth Hospital, Mr. Nigel Whitehall, the Chief Operations Officer of the Queen Elizabeth Hospital, Dr. Christine Greenidge, the Director of Medical Services, Mr. Anthony Harris, the Chief Environmental Health Officer, Miss Francine Bascom, the Manager of the Psychiatric Hospital, Mr. David Leacock. Mr. Chairman, I thank you for giving us the opportunity to present on the work undertaken by the Ministry of Health and Wellness over the past year and to outline some of the plans for the next financial year. Our estimates recognize the fact that there are a number of challenges in the health sector that need to be addressed. These include the recurrent issues at the Queen Elizabeth Hospital affecting the delivery of healthcare at that institution, the scourge of NCDs, while we seek to reduce new cases by 50% by 2030 as part of our mission, the reform of our mental health system while monitoring new and re-emerging infectious diseases, and the global threat of AMR, the need to upgrade our polyclinics as we refocus on primary health care, and the absolute necessity to strengthen our health information system while paying attention and preparing for the climate-related health issues. So I'm pleased to report that despite the aforementioned challenges, there have been several initiatives in the Ministry of Health and Wellness, both at the policy and programmatic level, which we have implemented and will continue to implement more in the next financial year. The ceiling for the Ministry of Health and Wellness this year was capped at $355,734,764. And the approved budget for that was the approved budget for 2023-24. The Ministry of Health and Wellness new total for the draft estimates for 2024 to 2025 is $317,149,901. The reporting period was the first year, Mr. Chairman, that non-communicable diseases program had its own budget, separate from health promotion. The allocation of dedicated resources enabled an advancement in work across cancer and cardiovascular risk reduction, as well as childhood obesity. Initiatives included the development of a colorectal cancer screening project and training of trainers in self-management of NCDs. A partnership with the World Health Organization resulted in the hosting of the Small Island Development States Ministerial Meeting during the 14th to the 16th of June last year. The Ministry of Health continued to address hypertension and associated factors, given the position of cardiovascular disease as the #1 cause of death locally. With support from PAHO and the Heart's Cardiovascular Risk Reduction Program, was strengthened across all polyclinics and introduced to the private sector to better control hypertension and the resulting cardiovascular morbidity and mortality. A wider national nutrition policy was drafted in collaboration with the Ministry of Agriculture and Food Security and other stakeholders. And this document builds on the school nutrition policy and provides a wider basis of interventions across the population with major nutrition issues. The ministry continues to purchase services from Heart and Stroke Foundation, the Barbados Diabetes Foundation, and the Barbados NCD Register to ensure the availability of cardiac rehabilitation, specialist diabetes care, and monitoring of cardiovascular and cancer outcomes. We've also engaged partners in creating a screening protocol for breast cancer, and PAHO has facilitated the creation of a cancer risk reduction messaging focused on the leading cancers. The colorectal project, in addition to developing guidelines to improve colorectal cancer screening, the ministry has created an initiative that strengthens screening by allocating resources to enhancing laboratory capacity and improving access to colonoscopy, and has also, as I said, developed protocols in collaboration with local gastroenterologists. In the area of primary care this year, all polyclinics receive automated external defibrillators. In addition, the polyclinics in the psychiatric hospital are in receipt of vital signs monitors, portable blood pressure monitors, and Doppler ultrasounds to measure blood flow in lower extremities. Training has been completed. Training has been completed for medical and nursing staff in the correct use of the equipment. The Best of Santos Public Health Laboratory was designated as the National Influenza Center of Barbados as part of the WHO Global Influenza Surveillance and Response System. We come to the Queen Elizabeth Hospital. Following 3 years of dealing with the impact of COVID, the hospital managed to stabilize its operations into the latter part of 2023. The persistent effects of the pandemic were evident in patient care, with an influx of individuals seeking treatment for non-communicable diseases in clinics and at the accident and emergency department. The backlog of patients who needed elective surgeries during the pandemic was regularly scheduled for these procedures as elective surgeries resumed. By the end of this financial year, the QH will move from 7 to 9 theaters being fully operational. Resources are being sought to sustain 9 theaters in use until the roof and the 3 theaters in the Lions Eye Care Center are refurbished and an additional 3 theaters are open. Over 100 cases were booked weekly, and this was achieved now by maintaining earlier start times and the introduction of pre-anesthetic clinics and the reduction in cancellation rates by as much as 30%. Cancellation rates were also reduced by increased nursing availability in the operating theaters, and of course, improve on time starts for the first scheduled cases. Traditionally, they started late, and this caused delays throughout the day. There was also reduced readmission of vulnerable patients through the Transitional Community Care Project. The QH replaced and upgraded its 64-slice CT scan with a 128-slice machine, which provides a much faster image acquisition time and allows for a wider variety of complex scans. The QH also procured 60 peritoneal dialysis machine, and these are for home dialysis to allow persons to have treatment at home. The QH commenced the installation of an additional 50,000 gallon water tank, and this will improve the overall capacity and allow for self-sufficiency, particularly in disasters and emergencies. And in terms of the hospital recapitalization, the QH is in an advanced stage of discussions in securing financing of approximately $130 million for infrastructural and equipment upgrades for the next 5 years. As it relates to mental health, a mental health hotline was established, and this will provide information, emotional support, and crisis intervention services. During the review period, the psychiatric hospital prioritized the renovation of its occupational and recreational therapy buildings. As it relates to geriatric care, the construction of the new geriatric hospital facility commenced with groundbreaking in March last year and is scheduled to be completed towards the end of this year. The construction of the facility, of course, is being implemented by Barbados Tourism Investment, Inc. The delivery of services at the new facility will be focused on providing clients with the medical, nursing, and rehabilitation care needed to reach optimum physical and mental functionality, promoting dignity throughout all phases of care, and maintaining independent living for as long as possible. The facility will have a bed capacity of 408 when completed. In relation to environmental health, the Ministry of Health has changed the system of granting free pratique from a paper-based to an electronic system. And this new system allows Port Health to be aware of the health status of passengers and crew before an airplane lands. As it relates to vector control, the department persisted in implementing the Integrated Mosquito Management Program, emphasizing efficient resource utilization for sustainable vector control, and the strategy promoted cost effectiveness and aimed to reduce mosquito activity significantly. In the area of nursing, nurses contributed to the successful implementation of ongoing initiatives aimed at revitalizing routine childhood immunization programs and outreach programs in communities and schools. The re-engaging of defaulters through extensive outreach programs is a priority, with a specific aim of returning to pre-COVID vaccine coverage of over 95%. And this is especially important with the possibility of a measles outbreak. To assist in this effort, a new mobile clinic service has been established. This initiative increases access to healthcare and the visibility of nurses in the community. The mobile clinic targets vulnerable groups such as the elderly, young men on the blocks who would normally seek medical checks at polyclinics, and provide care for antenatal and postnatal mothers who are employed and cannot afford to lose a day's pay if they attend the polyclinics. It also offers an expanded service to postmen, police officers, fire officers across the island, and is easily accessible to schools and workplaces targeted for outreach programs. Its services also include health education, immunization, NCD checks, and pap smears. In terms of the next year, the strategic direction for 2024-2025, as relates to the QEH, aim to have a fully functioning, expanded accident and emergency department, well equipped, including with a CT scan, and obviously seeking to obtain much reduced waiting times. Also looking at reduced waiting times for certain gynecological surgical procedures. There's a plan to recruit additional nurses from Philippines and Ghana, and also to recruit medical specialists and physicians and paraprofessionals. There's a plan to further increase the number of operating cases from 100 a week to 125 per week. Plans to address expanded need for evening anesthesia time and more weekend surgeries. Also plan to enhance coordination of elderly patient placement within district hospitals, and aiming to achieve a 24-hour operations in departments that require to have on-site staff to ensure timeliness and efficiency of care services. And obviously, to commence continue refurbishing of wards for functionality, patient satisfaction, and of course, better staff working environment. As it relates to NCDs, the Ministry of Health and Wellness will in the upcoming year continue updating diabetes management protocols at the primary care level. And in addition, the Ministry of Health will address challenges associated with NCDs through the following. We'll continue to work with the STEPS risk factors survey to establish risk factor surveillance systems, strengthen data availability, and enhance the understanding of NCD risk factor exposure. Additionally, the Ministry of Health will look to implement screening protocols for colorectal cancer while advancing work on protocols for cancer screening for breast and prostate cancer. The ministry will also conduct cancer risk reduction messaging to inform and empower the individuals to better reduce the risk of certain common cancers. And also, the ministry will complete the national nutrition policy and use this as a basis for creating better informed plans and a more supportive environment for health. In health promotion, the Health Promotion Unit is set to collaborate with the National Task Force on Wellness to advance the ministry's wellness initiative. And during the upcoming financial year, the Health Promotion Unit plans to focus on 4 main public education campaigns, including vector control related to rodents and mosquitoes, infection prevention and control, healthy schools, as well as antimicrobial resistance, and of course, the NCDs. As it pertains to the psychiatric hospital and mental health, the website and healthcare performance dashboard is anticipated to be enforced by the end of the year. There are plans to develop and roll out the psychiatric hospital's website to aid in providing critical information and services, as well as providing information to aid in reducing the stigma associated with mental health illness and increasing awareness of mental health. In addition, there's planned to be an expanded community mental health programs and a mental health action plan. And the psychiatric hospital will fully roll out the 5 mental health action plans: suicide prevention, psychological first aid, workplace wellness, anti-stigma campaign, maternal mental health during the coming financial year. And as I said, the psychiatric hospital will seek to transfer clients of the outpatients department to the community clinics, these are the polyclinics, towards moving to full community integration. I know I'm running out of time, Mr. Chairman. As it relates to nursing, we've made arrangement with Chamberlain University to train 30 nurses to the level of nurse practitioner over the next 2 years. And as it relates to environmental health, water quality, there's now the water reuse licensing program, and the ministry is moving along on that. But there's plans now for a concurrent public education campaign to be launched to enhance awareness and understanding of the legislation. And finally, technical management service plans to do a lot of work in terms of renovations to some of the polyclinics and the geriatric facilities during the course of the year. And of course, the ministry will be working ahead in terms of its digitization of its IT systems. Mr. Chairman, I believe you've indicated that I've approached my limit. And in concluding, the Ministry of Health will continue to move the health agenda forward. I again thank the staff of the Ministry of Health and Wellness and the Queen Elizabeth Hospital for their efforts, their dedication, and hard work in providing health care to the citizens of our country. I thank you.
Mr. Chairman, I beg to move that Head 86 stand par.
The question is that Head 86 stand part. All honorable members in favor, say aye. All members against, say no. Methinks the ayes have it. Honorable Leader of the Opposition.
Thank you, Mr. Chairman of Committees, and good morning to all parliamentary colleagues, and good morning, Minister, and to your entire team from the Ministry of Health. The Minister has been more technical than I can be in his presentation, and since I cannot be as technical as he is with his authority, my perspective may be rather different. And I come to this task with the recognition that this minister, the senior minister, is such that he is a senior minister and therefore comes to this position and to this present task with very high authority. And he may not mind that I will say that within the hierarchy of government, he is probably the one with highest authority among all the ministers, except, of course, the Prime Minister. He may not mind that I will say, and I must say this if I am to make the point that I intend to make, that he becomes a part of the duumvirate of power that constitutes this government. High authority, and he must be taken seriously. I describe it as a duumvirate of power. You may find it ironic that he is not a member of this place, and being a member of the other place may be wise Machiavellian politics, that the person who is closest to you, the person who is the other part of that duumvirate, must be in the other place where ultimately he is probably at the disposal of she who associates with him in that duumvirate of power. It may offend other persons who hold title, who, I don't wish to use the word pretenders, but there are others who hold title within this government, and the public needs to know this, that there are others who hold title in this government who do not have the authority of this honorable minister. They don't. You have people given various assignments, some noble, some not so noble. You would have those who are sent into branch meetings to do various things and to say various things about people. So I think I need to establish the intrigue of this minister's presence in government and in this place and in this ministry, to indicate to you that this minister comes with not only high authority, but great power within his hands, within what I call the duumvirate of power that characterizes this government. I take him very seriously. And being so located, he would want to take credit for the good that this government does, as a senior minister, as the most senior of the senior ministers, and he will want to accept this credit for what is not so good. He began by saying to you, Your Honor, that the QEH, he focused on the QEH, and he's right in that regard. The QEH stands at the center of the Ministry of Health. Unless there were a QEH, we probably would not spend as much time as we do. The government would probably not spend as much money as it does on health. It is the QEH which is the focal, which is at the center of health administration in this country. And in saying that, I want to move now to a decision which the government appears to have taken within the past few hours to appoint a CEO, and this is public, this is a public matter. and it is not something that the public avoids because the public is paying this person. And of course, I will pause and say that the appointment of that chief executive officer of our principal health institution would not be a matter within the purview of the existing management of the QEH, but it would go to that duumvirate of power and it would go to that duumvirate of power and then, of course, be transmitted to the chairmanship or the board of the QEH. But we understand politics and we know how these things go. So anything I say is not intended to reflect on the existing management of the QEH. The point I want to make is that being so critical, the QEH being so critical, that the appointment of a CEO must be something that comes to public attention. We know that the person designated is an Englishman. I think we've been told that. I heard the minister on the news saying that. I think he confessed to that. And he made a very interesting statement in that press release. He said, only 2 Barbadians had applied. I don't remember, he will have the opportunity to say, I don't remember that he said how many Englishmen applied, or English women for that matter. But it was I wondered if it was not an invalid way of reducing the argument to statistics. Why do you have to tell Barbadians that only 2 Barbadians applied? It is not a statistical argument. And Barbadians will begin to wonder, are we not fit to run our hospital? Whether it is 2 or 22, if 1 had applied, is he less fit or she? If 2 applied, are they less fit than the 1 guru who will join shortly? What are we saying to Barbadians? You know, the social scientists talk about negation of self. And here we are negating the worth of an entire population of persons who are probably qualified academically, intellectually, and otherwise. But you reduce it to a statistical argument. Only 2 applied. And therefore, one must conclude that you're saying 2 Barbadians are not equal to 1 Englishman. And so many years after the 30th of November 1966, we must reject that argument. It is not an argument that has validity in a modern Barbados. I'm very concerned. And if you say that only 2 Barbadians applied, are you admitting that Barbadians do not feel inclined to apply because they feel that the position will not be made available to them? Ministers, beg your pardon, Your Honor, to the minister through you, it is not only the Queen Elizabeth Hospital that is now afflicted with this cultural problem. We understand that in housing, who have not presented themselves before us, you now have hope under the chairmanship of a South African. We hold nothing against South Africans. And under the chief executive office of an Englishman. And if that is the mood in this country, how do you expect, Mr. Chairman, to the minister through you, how do you expect Barbadians to apply and feel that they will qualify for these positions? I beg your pardon if I'm shouting, but anger is legitimate against injustice. And I am saying that the government is on a trajectory where it is seeming to reject qualified Barbadians to occupy these high offices. The position of a CEO of the hospital is not exclusively and entirely technical. All work is cultural work. And I say in here today that a young Barbadian or even a young West Indian who is familiar with the culture of this place is as well qualified as anyone and better qualified to deal with people. Chief executive officers don't deal with machines, they deal with people, and they deal with the problems of people, and they deal with a health institution. And indeed, matters of disease are also cultural. So what is this justification? What is this search for supermen and superwomen to run our institutions 60 years after the University of the West Indies was born? Many, many years after the 30th of November 1966. What is this mood? What is this attitude in government? That Barbadians now are disinclined to apply for jobs in high positions in the public service. And they are so disinclined if the government's attitude is towards their exclusion for the sake of people who we are told are super people. And I'm not going to reflect on the passage of the legislation nor the content of the legislation. But I've already said in here, recently during the debate, that legislation must be passed for the common good, not for individual enfranchisement. And this country now stands at a juncture in which we are saying to our young Barbadians that they do not qualify. I repeat, whether it is 2 or 22, we must be able to find 23 young West Indians who qualify for this cultural work, the work of CEO of our main health institution. That, Your Honor, I see you drawing the microphone again. I believe that is a sign to me that my time has expired.
Yes.
How many seconds, sir?
2.
2 seconds.
2 seconds.
What do you want me to say? 2 seconds, that only 2 Barbadians applied? I will wrap up, sir. I will wrap up and express concern. I will wrap up and express concern that the government is excluding young Barbadians and young West Indians from the occupation of high office, and we look forward to the day when we cease this negation of ourselves and affirm our equal right to occupy high places. I am obliged to you, sir.
Thank you. Honourable Minister.
Mr. Chairman, thank you. I wasn't sure if there was a question, so I was waiting patiently for you to indicate.
No,
if
that's
there
not a
was.
question. That's not a question, sir.
But
I believe I have 3 questions.
Can I, since I was so viciously attacked, can I respond?
On the contrary, sir, I praise the minister as being a part of the duumvirate of power
Honourable
to the
Leader-
exclusion of
Honourable
Mr. Chairman,
Honourable Leader of the
He
Opposition,
is the
allow
second most powerful man in
Honourable
Barbados.
Leader of the
He went
Opposition,
on.
allow the Honourable
It's not
Leader.
a question,
I
sir.
cautioned you before in this honourable chamber. You cannot refer to members of this house as them, he, she. They are honourable members.
Those honorable members who are pretenders.
Also, are you imputed improper motive, honourable member?
No motive there.
He doesn't
It is a
want me to
hierarchy.
speak.
I am describing a hierarchy of government
Honourable,
in which this
honourable
minister is the second
Leader
most
of the
powerful minister in
Opposition,
Barbados.
that is not the discussion of this house, who is most powerful or whatever. The honourable
Second
minister
most, I
is
say.
here to speak and tell Barbadians, as you so like to inform the Barbadians. He has the opportunity, honourable Leader of the Opposition, to speak to Barbadians regarding health in Barbados. And I would like you, therefore, to give him the opportunity, just as you are given and will be given if you have any other interventions, any questions, to respond. Thank you, honourable member.
I always obey
Thank
your
you,
rulings,
Mr.
sir.
Chairman. I wonder why the Honourable Leader of the Opposition doesn't want me to respond. Mr. Chairman, he made certain accusations about the selection and this process for a CEO for the Queen Elizabeth Hospital. This process has not been in secret. This was made known in last May, I believe it was. Prior to that, it had been indicated in speeches. I believe the honourable member from St. Philip North had spoken about that. Other people had spoken about it. The then executive chair had indicated that she was going on to a different role, a different career path, and that she was leaving. An article was carried in the nation, in one of the daily newspapers, sorry, I almost called the name, and it spoke at length about the process. And the chairman had spoken to it publicly. Ads went out in the press here and internationally. The board had made a decision. The board had been told that this is their process. The QH is on their board of management. And the board took responsibility for the process at that time. That was in May 2003. I have not interfered in the process, contrary to the assertion of the leader of the opposition. I have had no role in it. The board met. They had their selection committee as members of the board. My PS was on the board. I believe the General Secretary of the NUPW was a member of the selection committee. They advertised, 84 people applied. I made the point, and it wasn't any publication, I made the point then, this was 2 days ago in the other place, that 84 people applied for this post. 2 were Barbadian. I was concerned about that. That's why I said it. So I don't know about this nonsense about two Barbadians being equivalent to 1 Englishman. For the information of the chamber and the lead, honorable leader of the opposition, there were 43 Trinidadians. And since he cares so much about Barbadians, prior to the last CEO was Dr. Dexter Drains, and he was not from Barbados as far as I recall. Now, if the honourable member is concerned about people coming from the UK to take jobs that young Barbadians should have, I suggest he speak to his president. Because this same Ministry of Health, in the interest of care for people in Barbados, hired someone very close to his president, who by no stretch of imagination is the same color of any of us in here, or is indeed a Barbadian. But I'm going to ask the chairman of the board to speak to the process, sir. Thank you. The chairman, who's here.
Honorable Minister, before the chairman speaks, just let me give a couple of ground rules before we get into that situation, that position. Minister, you have 5 minutes for any response that you wish to give. Mm-hmm. You have 5 minutes. Members of your team have 3 minutes, and I'm asking that when you are speaking for the first time, that you give your name and the position you hold within the ministry. So you have 3 minutes to respond. You give your name and the position you hold before you begin to speak. For honorable members of this House, your questions cannot exceed 3 minutes. If you so utilize your lead up to the question, your 3 minutes to lead up to your question, then that will be deemed a question, and we will then move on to the next person. Just be clear, you have 3 supplementary questions as well. I am going to be very tight today with time, so let us stick to the time frames as we discuss Head 86. Honorable Minister.
Nigel Whitehall, Acting Chairman of the Queen Elizabeth Hospital. Sir, the selection process for the CEO, the position of CEO of the Queen Elizabeth Hospital commenced with an advertisement, a public advertisement, which went international. The advertisement contained the requirements, qualifications, and job requirements for the individual. That ad attracted 84 applicants from various parts of from a number of countries around the world, including 2 2 Barbadians. Having received the applications, a subcommittee of the board of the Queen Elizabeth Hospital, including the General Secretary of the National Union of Public Workers and the PS in the Ministry of Housing, who's an ex officio member of the board. Ministry of Health, right. The PS was appointed as the chairman of that subcommittee to oversee the selection of the CEO. All the applications were vetted by the subcommittee based on the job requirements and the qualifications of the applicants. Having done that initial screening, the subcommittee selected 12 persons who met the qualification standards. Having completed that process, the committee engaged the services of a management consultant to assist with the selection process. A survey was done of the managers, the board, union representatives within the Queen Elizabeth Hospital to determine the characteristics and qualities they would wish to see within the incoming CEO. Based on the analysis of those results, that survey result, psychometric testing was conducted on those applicants, which covered the areas of competencies and characteristics which the members of the QEH staff and the board determined were essential to the development of the institution. Having received those results, the subcommittee then made a short list of 6 from that 12. One individual opted not to face the interview, and 5 individuals were interviewed. Of those 5 individuals, recognize that there were 2 individuals who were able to meet the standards which we believe would have been an effective CEO for the institution. And the top performer and the person who came second were notified. The top performer accepted the position, and that has been the situation there. And that's how the selection committee then recommended the selection. Having interviewed those 5 persons, the selection committee then recommended to the board of the Queen Elizabeth Hospital.
Time on Mr. Chairman.
The individual.
Time.
Thank you, sir.
Thank you. Honourable Leader of Government Business.
Thank you, Mr. Chairman. A pleasant good morning to the Honourable Minister and to his entire team. I've had the opportunity to work very closely with the Ministry of Health, certainly during the COVID-19 period, and I appreciate and understand a lot of the challenges that the ministry does face. I have been very vocal as it relates to a number of improvements that I certainly would like to see take place in terms of our transition and transformation of the healthcare system. You know, I wasn't planning to speak this early, but I must say that, you know, there are times when I feel that an intervention is necessary, particularly when we are discussing an issue that is so important to every single Barbadian across this country. If you don't have money, You're going to end up at the Queen Elizabeth Hospital or in one of the polyclinics. And I certainly wake up every morning, 7 days a week, hearing from ordinary Barbadians about their concerns about healthcare in this country. Those who can afford to go overseas will do so in terms of being able to have options, but for ordinary Barbadians and for the majority of us, the options obviously that are available at some point is to go to QEH or to seek care through the hospital. It was therefore a bit surprising that the lead-off comments from the Leader of the Opposition related not to the cries and the pleas of ordinary Barbadians for information about the improvements and the transformation, but that it would start off this morning's session regarding the appointment of the CEO. And I'm thankful to Ministry of Health for explaining the process. I want to say that this administration has no intention to deprive anybody from, whether a Barbadian or anybody from the region, from being able to take up the leadership of any department of government. There is a process that we follow. We will continue to follow that process. But we also live in a world where we have to look for the best minds and the best people to be able to help to carry out the important work of the Ministry of Health. And whether those persons have to be found from outside of these shores, whether they do not look like us, at the end of the day, I think what should be occupying the minds, regardless of where we are across the political divide, is the thrust to ensure that we are able to cater to the people who are most vulnerable in our society, who deserve the assistance from this Ministry of Health. So I thank you, Minister, and your team for the answer. Now, today I celebrate my 48th year of birth. It is ironic that the Ministry of Health is the ministry that is being debated today. I have reflected, sir, on the last 5 years as I got ready for this morning's debate. And I did so, sir, because most of you know that in 2018, I would have indicated to the country my diagnosis of breast cancer. I've had a journey unlike no other as a public figure, as a female, certainly, and as one who, having disclosed the journey that I took, I have had people of all walks of life approach me to share their concerns regarding healthcare. I spend many days, sir, and Minister, interfacing with a public that expresses concerns to me about many issues, but in particular about cancer. And I'm going to start there because I will come back certainly during the course of this debate on other aspects of healthcare. But I want to start with the issue of cancer and certainly the aspect of diagnosis. We had a situation back in 2007, 2008, Minister, where I know you would have been at the vanguard of trying to get us a linear accelerator. I suspect the records will show that it did not occupy the attention of the other administration at the time in terms of the improvement of key equipment that was needed at the hospital. And I would like to think that any administration coming to office would certainly look at what is needed, look at how we will be able to replace old equipment to ensure that we always have a cadre of equipment that is available to the hospital for use by its patients. But I know that thrust that you had was replaced subsequently, I think in 2013, by the introduction of another machine, the Cobalt machine, which has now, for the most part, my understanding is, has become outdated. And in recent months, we have seen headlines raised regarding the treatment of patients for radiation. This is a machine that usually after you've undergone chemotherapy, you then would go through a process oftentimes of going through radiation. And I am concerned that there are a number of persons who have been asking of me repeatedly about what are the options available to them if they're unable to seek treatment through the radiation department. I know that there was a period where persons were still being treated, but there were also persons who, based on the articles, suggested that they could not receive treatment. I recall the response of the ministry was that the ministry had done its investigations and had looked at other countries where persons could have been recommended to be sent to through the medical aid scheme. I know that the medical aid scheme does not have a wash of money, And therefore, I know that decisions will have to be taken as it relates to who is able to qualify for that money for persons to be able to be sent to different jurisdictions. Minister, I know that we do not have never-ending funds to be able to send people to various destinations for care. But what troubles my soul is that we need to, I think, address this issue, and perhaps you can speak to it on your staff, as to what are we doing? How many people are seeking the radiation intervention? How many people have we sent off for intervention through the medical aid scheme? What is the status of the linear accelerator? I'm told you all were purchasing it, but I'm not sure the status of those negotiations. And what do I tell the person who has been diagnosed at 32, who is about to go through chemotherapy, who has a 2-year-old child, that will not know whether or not they're going to be able to access care here in Barbados because we haven't either paid for the machine, or we haven't sourced the machine, or we haven't built the oncology unit that we have said that we were supposed to build as yet. I want to know, what do I tell them at 5 o'clock, 6 o'clock in the morning when I receive the calls, or at 11 o'clock in the night when they've put their children to bed and they're seeking consolation, explanation, you know, as to what are the next steps, what does the future hold? Because I know what it is, Minister, to have that uncertainty of what are the next steps. And I feel that despite my being in a position where I had the opportunity to go overseas, and I give thanks for all who supported to be able to allow me to do that, I equally know that I have a responsibility not to be muzzled, but to shout as loud as I can and to ask the questions that I can, so that I am in a position to help you, Minister, and to help your team to let those persons know what their options are. Because worrying about a diagnosis is just as bad as worrying about what the next step is going to be in terms of your care. And I therefore would wish that your team can bring the country up to date as it relates to the status of this linear accelerator, the status of oncology generally, because it's not just breast cancer. We have high rates in terms of colorectal cancer as well. I think we're the 3rd highest. We're in the top 25 of Caribbean countries in the world. And while we will screen and we will know the statistics as to who has been diagnosed with what we cannot answer with clarity as yet is what are the next steps in relation to radiation.
Thank you, Minister. Honourable members, sorry. I think my position on cancer treatment in Barbados, I believe, is quite well known. As you said, as far back as 17, 18 years ago, I was advocating for the need for a linear accelerator. At that time, funds was a problem. This was in 2006, 2007. I was also concerned about mammograms. It's when we were kicked out of government in 2008, the mammograms were being done at the Queen Elizabeth Hospital. I gathered that the last mammogram done there was sometime in 2009. I have a concern. I'm starting there. I'm going to come to the linear accelerator because it concerns me as it relates to breast cancer in Barbados. We are certainly in the top 3 as it relates to the rate of death in the world globally. I don't want to get into the stats now because some people may argue otherwise, because we have such a fairly efficient system in screening thus far that we can pick up, whereas other countries would lose people. But I also felt strongly that where we get mammograms in Barbados, you have to pay for them. Some might say it's just $100, $120. But there are Barbadian women who cannot afford that. And I'm always concerned that they have to be then referred through social services, sometimes to get referred to get a mammogram outside. And I believe, and that is one of the first things I've told the QH, that we need to start doing mammograms at the hospital again. As it relates to linear accelerator, there's a lot that has been said, and I know you had 5 minutes, so I could speak for an hour, but a lot has been put in the press. It is worrying, it is depressing, the state of affairs, that in 2024, we should be in a position to offer our patients who have cancer, who need radiation treatment, they all don't need that. We should be in a position to offer it. I believe at one time, theoretically, we were thinking of having meetings, and I had this grand dream that Barbados would be a center for the OECS to refer people for this. It never materialized. And it is something that we need desperately. It really came into effect. I remember when you were acting as Prime Minister, I was overseas, and the whole issue came about in discussions about the state of affairs at our oncology department. First, I need to set the record clear. There was a malicious article written a couple of weeks ago about people saying that a piece of equipment has been not functioning for over a year. And I've heard the president of the leader of the opposition, who I believe is now covering health, who I believe is now spokesperson for health. I don't know if he sent him in here today with notes, not you, Mr. Chairman, about not working for over a year and inferring that that is a linear accelerator is broken down. I just want to let the chamber know QH will be 60 years this year. It has never had a linear accelerator. And indeed, when that article was written, the brachytherapy machine was working, the cobalt machine was working, and indeed the gamma CT scans were all working. As it relates to equipment for radiotherapy, we had one issue during the cybersecurity attack when I believe 2 pieces of equipment were down for 2 years. So that is just malicious and nonsense. Just over 2 weeks, 2 to 3 weeks. The linear accelerator, the QH, we have specs, finally. There were issues before that we needed to build a bunker and a separate facility for a linear accelerator. I've been informed that there are smaller, just as efficient units available now. The plan is to acquire one and to place it, rather than we don't have to build a bunker, that is what I've been assured, that it needs, it can be placed in the space where we have the cobalt machine. And they will have to do some adjustments, and also as it relates to keeping the equipment air conditioned and stuff like that it can be placed there, being assured of that. We have received the specs and the costing. The government has agreed, and there's been a decision that the QH will acquire a linear accelerator this year. I know for certain it's quite expensive, Honourable Member. It costs about $3.3 million for the unit. This is US. And then the outfitting, et cetera, have been given a figure of roughly over $1 million US. So you're speaking about almost $9 million, maybe in Barbados dollars. And I know that already the QH has received some substantial funding as it relates to the acquisition of this linear accelerator. So the process now is going through the ordering process and obviously outfitting the area where it will be placed. There are matters along its course with training. Our physicists, I think they've had some exposure to linear accelerator during their training, but obviously they will need some refresher, stuff like that. There are posts for 2 oncologists in the QEH. They were created some 2007 or something like that. And we need to fill both of those posts. I mean, we can't run an oncology department with just 1 consultant oncologist. Meanwhile, we have been sending persons who need radiation treatment to Colombia. We looked at the costs in Miami, we looked at Jamaica, we looked at Martinique, we looked at Trinidad, which we used to use traditionally for sending patients for cancer treatment. But we also found that, that Colombia now is cheaper, offers the best. And we do send patients there. We sent several patients, I'll have to ask the financial controller if you allow, Mr. Chairman, the exact number, but we sent quite a few patients to Colombia last year for radiation treatment. And already this year, it is true we used the medical aid scheme, which had about $1.75 million in it. And the QEH has gone further and has been utilizing funds from the NIS Health Levy to allow for persons to go there. We not only pay for the patient, but we've been sending escorts, which is an additional cost. And the escort is to be there for the period of time when the person receives treatment. It is something that is also, we're saying that the cost of 2 escorts can pay for 1 patient. So it's something that we have to look at. But we recognize that this is a serious problem. We should not be in this situation in 2024 as a country. And we are moving seriously to address it. I give you my assurance. As I said, funds are already available. It is regrettable that while we were in the political wilderness, the other grouping, who all has this new reawakening, this concern about cancer treatment. I don't believe it is something that should be political, but you would expect there to be some continuity of treatment. As I said, we never had a linear accelerator. We're moving to one. We had mammograms, which would allow early detection. And under the watch of that group, that went into abeyance. So I think we need to do some catching up. And as I said in my opening, we are looking at cancer, screening for cancer, recognizing that if you pick it up earlier, the outcomes are much better, and you can save more people from cancer. And that's why we're looking at colon cancer, which is number 3 and rising, but also at the same time, we are working on the protocols, and there's work out there already with breast and stuff, but we're looking to improve that. And it is certainly on the ministry's radar, cancer and its management. I don't know if the financial controller can say exactly to answer your question. The other question was you asked how many people. I've been told that there are about 400 to 500 new cancers every year. Not all of them would require that.
Good morning. Name is Adrian Hurley, Director of Financial Services, QH. To date, we've sent about approximately 15 patients to Colombia for radiotherapy. We have allocated about $265,000 coming out of the health levy, like the minister said, towards the treatment of those patients. What we are doing is we're using those funds as a stopgap to treat those patients as we transition for that period where we transition from the cobalt machine disassembly and decommissioning and the reinstallation of the installation and commissioning of the linear accelerator. So those patients during that period will not be in any way disadvantaged regarding their treatment.
Can I just ask, Minister?
Sir, I beg your pardon. Your Honor, on a matter of elucidation, in response to my public protests as to the limits on my time, I have subsequently been given the assurance that on behalf of the people of Barbados, I have the right to intervene after every exchange between a member of the government and the minister who is in the well, the ministers who are in the well. And if that is so, and you will confirm that, Your Honor, I beg to make an intervention in response to the last question and the last response, and the last 2 responses, but more particularly, the last response. I was given this assurance. So if that is the case, Your Honor, and I believe it is, please permit me, on the behalf of the people of Barbados, to intervene at this point.
Honourable Leader of the Opposition, I am surprised that you were not aware. We have repeated the what times are allowed for you as the Leader of the Opposition and for all honourable members. You can intervene at times, but that is at the discretion also of the chair.
Yes, of course. And you...
So it's not every single person that may speak and so on, that you will be allowed to intervene.
We have confidence in your sense of fairness, sir. And I will beg you now to allow me to intervene.
Yes, and one intervention, thank you.
I'm obliged to you, sir. Now,
The honorable leader of the House is not finished yet.
yeah,
You can come after her.
I beg your pardon, sir. I was given the assurance that after each question,
No,
series of questions,
honorable member.
if it is series of questions, I'll wait. I'll wait until
Mr.
the...
Chairman, as leader of the House, this has never happened in the course of these estimates for as long as I certainly have been in this place. The honourable member perhaps is now becoming acquainted with the rules of the House, but those rules cannot change because this honourable member is now the leader of the opposition. I am not finished my questions. I'm sure members will give way after I have spoken.
I defer to you. Happy birthday.
Thank you.
Good.
Sir, I hear your response in relation to the number of persons who've been able to seek treatment in Colombia, and I'm grateful that we have found an option available to those persons as they worry about what the next phase will have on their journey. You've said that it costs $9 million for the linear accelerator, Barbados dollars, for us to get that, and we're making attempts to be able to get that in place hopefully by the end of this year. But I worry about the number of persons who did not make the list of 15. Because in many cases, those individuals, I don't know at what stage of cancer they are. Obviously, if they are at stage 4, there may be a different view of treatment. But I am just concerned as to what are we doing in relation to the rest of those persons. There are 400 cases, as you said, across different cancers. Specific to breast cancers, I mean, how many are we talking about in terms of these 15? 15 out of how many are we talking about? What are those other persons supposed to do? Is the hospital providing any support specifically for those persons? And I ask that because I find that oftentimes, even when people receive the diagnosis, the whole issue of patient education, being able to fully understand and appreciate and to manage what lies ahead, is sadly lacking in terms of our communication with patients. Now, I think people are reasonable if they understand that they have a terminal illness, that there's not much that can be done. But if it is that they are just put on a waiting list, but they're not quite sure when they're either going to see the benefits of the linear accelerator or whether they will make the cut to get onto the list of 15. I think that we ought to also have a program in place to deal with the interfacing with those individuals while they wait. And I say this from a position of personal experience, that it is not easy having a diagnosis and being uncertain what the future holds. And I would therefore urge that while I think we can all accept in this room that there is significant costs to be borne by the government, equally I think we accept that lives must matter. And because somebody is at stage 3 or is at stage 4, does not mean that they don't have families, they don't have children, they don't have grandparents, they don't have a brother, they don't have a sister. There are people and our lives, these lives must matter, Minister. And I would like to hear whether there is any support or any intention to be able to support those persons as it relates to the patient education side, while they wait, and certainly how many persons are actually on the waiting list, because it may require that we have to modify the numbers somewhat in terms of what we are assisting in terms of the persons who are going to Colombia. $265,000 with an individual who is supporting that individual. I can tell you, and I would support it, that a person needs to accompany any individual who is going through radiation. And why, sir? Because in many cases, the persons, as you would know, Minister, it is a traumatic exercise for the person to go through. Sometimes you don't remember things, the doctor talking to you, the nurses talking to you, you don't remember nothing they said because you are scared. And while it seems to some as though it may be, a high amount to have to incur a cost to have another person as a companion, I would respectfully submit that we urgently consider and make that, let that not be a question that is raised any further in terms of whether we allow it, but rather that it is a must. It should be mandatory that a person should accompany that individual unless the state is in a position to provide a system whereby an individual can accompany that person and meet them on the other end or something like that. But I think that we need to hear how many persons are actually waiting at this present moment to be determined whether they can meet the requirements for radiation in Colombia.
First of all, the finance controller spoke of 15 people going. I would like to give this chamber, the Honourable Chamber, the impression that that is a cutoff. This is something that is done continually. They're seen by the oncologist. The determination after investigation is made as to if this person can benefit from having radiation treatment. As you said, all cancers this is not how you treat all cancers with radiation. Some are stage 4, probably just need more palliation, which can be done here. Then there's a process where the consultant, if the person has insurance, it's easy.
Yeah.
They're dealt with fairly swiftly. But then is the process of having to refer to come on the benefit for medical aid is the process of the interviews by the social worker to assess you. That has taken some time. And that is another matter to be addressed because they've been asking for additional social workers. And this is something that has been dealt with and has been agreed to recently. But once that process is carried through, we use medical aid, and as I said earlier, having used up the medical aid, the hospital has now been using its OPEX from the health levy. But of course, it now has to also use that as it relates to the living accelerator. I don't know how many, I can't tell you offhand how many people are waiting. I don't think it's as much as they said in the newspaper. When I checked, that was not the situation. I don't know if the financial controller or the director of medical services has the figures to how many are waiting, has an accurate figure right now waiting. As it relates to the process of talking to people, I know for a fact that the cancer support services, they're often there and there are persons who refer to them and they play a very active part. Some of the staff also try to do it, but we don't appreciate it. It's a situation where there's so many people dealing with it. It is not adequate. It is something that has to be looked at. I believe I had read that the QEH was trying to do something about it. Perhaps the COO might want to speak to this. I'm not certain how far they've gotten with it, but it is a real problem. The diagnosis of cancer and being told you have cancer and the issues of denial and going through depression and all of these things need softer skills and need obviously to be addressed properly. And when we are speaking in the context of having an oncology center, you would seek to address all of these other things and not just focus on radiation or cobalt treatment. So it is something that is engaged in an authority, but it has to be done, but is in a developmental stage. But perhaps the COO and the DMS might want to speak briefly as it relates to this.
Yes, good morning, and Acting PM, I want to just say that I took note of your diagnosis. I'm sorry, Dr. Christine Greenwich, I am the COO. In reference to your notation of your diagnosis in 2018, which means that you've reached a remarkable milestone in survivorship. And many will know that the 5-year survivorship for cancer is an important benchmark. So I want to congratulate you on that. In terms of our current situation with those women and men, by the way, the linear accelerated treatments are aimed at mainly breast cancers, but also prostate cancers in men. We have currently 5 patients that were in Colombia. 1 just returned to us on the weekend, and 4 continue their treatment. Currently, today, we are processing 6 more of these patients to receive the therapy in Colombia. And in terms of cost, we looked at Jamaica, we looked at Trinidad, we looked at Martinique along with Colombia to best see in terms of our dollar allotment for this treatment, and Colombia has been very, very dependable, and our patients have done very, very well. You asked a specific question in terms of the number of patients waiting. Did I hear that? Yes, so in check-in, it's very important in terms of treatment that the staging in which, in particular, women with breast cancer are presenting. And unfortunately, we hope for stage 1 or less, but most are coming in stages 2 and or higher, which means treatment is going to be different. There are procedures such as lumpectomies, for example, which is a simple removal of a tumor in the breast with adjuvant therapy, medication, and radiation if needed. Then there's mastectomies, which are many times are curative if the cancer has not spread. So they are about 75 people
officer.
waiting.
Thank you for that. So my simple point is that while we understand the cost of care for oncology, and this has nothing to do with all the other aspects of medical interventions that are necessary, we got people suffering with all kinds of things in Barbados, and I applaud the work that is being done, certainly in terms of encouraging people to eat better and to exercise more. However, I'm mindful that while there's a thrust clearly from the ministry to do more testing. That has to be balanced, obviously, with the ability to respond once you have been diagnosed. And I know that that is where the challenge often comes, because I certainly, in my experience in the last 5 years, have also found that people are scared. People are scared to be able to go to be diagnosed. They don't know what the future will hold, obviously, and whether it's men or women, there's always that hesitation to know. I encourage people to find out what is wrong, but I'm also concerned as to as I said before, the patient education, being able to arm people with the information that allows them to manage their condition. Because just because you have a diagnosis does not mean you're going to die. And I think that that needs to be the messaging that certainly is coming from the healthcare providers so that people understand how to cope. Now, yes, we have the other support services, but I do feel that whether it is internal or whether we are advocating for more people to be able to offer those services of support, perhaps the budget of the ministry needs to start to look at that more. I am on record as saying a large part of my recovery didn't just have to do with, I think, my positive approach to the condition, but it had to do with the people who supported me, whether it was the encouragement from the doctors, whether it was the security personnel at the hospital. It was just the way in which everybody understood in the healthcare facility that the type of diagnosis that you have is one where it's a very scary scenario for people to go through. And without that type of, what I went through was chemo education, and certainly education on radiation and diet and those types of things, you are ending up with a society where people do not understand how to cope. And whether that is the individual who is dealing with it or the wider extended family. Many men dealing with women going through these conditions do not know how to deal with it, and vice versa. And I do feel that while we are making strides, we cannot ignore the everyday real issues that people are dealing with. I remember I was at, and I'll wrap up here now, Chairman, but I share this, and I hope members understand why I am sharing in this forum, because this is too important a debate for us to simply deal with minor issues in terms of the process of the selection of a CEO of a hospital. People are crying out for interventions and for us to be able to transform the hospital. And if we don't take the time in these debates to deal with the real issues that as representatives that people are concerned about, I would then have to agree with the leader of the opposition that this process is a waste of time. But I believe that this is the forum to speak to it, sir. There are persons who, I remember the other night I was at one of the Paris Speaks, and a gentleman came to me about a diagnosis of his girlfriend. And she's at stage 4. Now again, he doesn't understand how to deal with all of the complex issues in relation to dealing with her, what the future is going to hold, the decision making that has to take place from her perspective in terms of her children or her future, her funeral expenses, how to deal with those things. Those are conversations which I believe, whether it is internal hospital or whether it is outsourced, are things that a modern hospital must strive to be able to provide. And I would again take this opportunity to encourage you, Minister, and your team, that in your prioritization of resources, that greater attention is paid to the aspect of patient education and support, while we try to build out all of these other support services and equipment at the Queen Elizabeth Hospital and the other facilities as well. Thank you, Minister.
If I may comment.
Yes, Minister.
Thank you. Honourable Member, what you said is absolutely true. As it relates to the patient education, we know that is vital at every step, as it relates to early detection, prevention, and certainly as it relates to cancer care and to treatment. You're absolutely correct. Patients have to be told about the effects of radiation, the effects of chemotherapy, and the whole issue of depression and mental illness. These things have to be addressed. Currently, we don't have all the resources. As I said earlier, it's done, by the staff in the clinic and cancer support services, but I do take the point that it's something that we need to focus on in the future. As it relates to the numbers, they told me that they've processed, there was 62 a couple of weeks ago, and since then 21 people, 15 have been sent, and there's 6 in the process. So as I said, it is not a limit. We do it in terms of the time it comes along.
And I would just simply ask that those individuals who have not yet been put into that pool, that special efforts are made to address their management of their condition as well.
And you've just stimulated something we may want to remember, in that last year there were about 2 or 3 people. At one stage I signed 7 people sometime last year, and in the end 2 of them decided that they weren't going. So you get that to patients that sometimes have to be taken along the journey to decide and agree to have radiation treatment. Thank you.
Your Honor, may I now have my intervention which you promised me? As the Honourable Member for St. Michael's Southeast has completed, you did promise me that I would be able to intervene when the Honourable Member completed. And I know you're kind and that you exercise your discretion reasonably, and that you know that the people of Barbados are entitled to hear from this side.
Honourable
One
Member.
out here, 20, a lot out there.
Honourable Member, yes, I will indicate when you would intervene, but I still have to manage this process.
I'm obliged
you
to,
will
sir.
you will have your opportunity.
Thank you very much, sir.
Sir?
Presently. That's a question, sir.
We have a process, Honourable Leader of the Opposition. You indicate you started by indicating, I mean this whole process, not today, when you wanted to intervene.
Yes.
And I wish that you would continue to do so by indicating with your yes.
Each time, sir? I put this up there and pull it back down?
No, it wouldn't be each time. You indicate that because there's a space that we have in order to manage honourable members on this house, and I'm sure that you follow Parliament on more than one occasion. You get the lead from the government side based on the balance, and we did this from back in 19
19, sir?
1999.
I was not here.
But you would have been following politics, right? So we've been balanced because we know that there's only one person on the opposition on the opposition side, and there are several government members.
Yes.
So in order to balance the process, we will do government. We will interchange government interchange, but not after every government member. But you will have your opportunity. There will be balance.
Yes, and you did promise me a few minutes ago that I could intervene
yes,
now.
And that I have. Yeah, I did promise you that you will speak, but I didn't say no.
But I wanted to respond to the Honourable Member.
But when you have, you can also do that.
Yeah, but that's going to be too far away. Why can't I do it while it is fresh?
You can take notes, Honourable Member.
So when will you promise me this?
Honourable Member, we have to proceed.
No,
we have to proceed.
I am very serious about this.
We have to proceed.
I was given the guarantee I went into the public domain and I protested that my time was limited to 3 questions. I sought advice. The AG tells me to go back in the press.
Honorable member, standing order governing this debate. 67.
67, sir?
3, and I saw you had it marked.
Yes.
I saw you had it marked in your
67-3?
67-3.
Yes.
And I go to the second line. A member is allowed 3 supplementary questions and 1 intervention, thereby giving way to another member without prejudice to his or her right to intervene on other occasions in the debate on the same head. Simply saying, honorable member, that you can always come back, but there's a time you have to give way. The chair determines that, and in all fairness, this chair operates from a sense of fairness to everyone in this house, and we have had this position from 2018, when we had, like you, 1 person on the opposition side as well. And we have not had, it has worked very well, and we will continue in that vein. But you would be given opportunity, and I'm not going to comment on your statement where you protested that you were not given time, because that is not, this chair does not operate like that. We have given you even an extension in relation to your opening comments, etc., and you are free to intervene, but there is a process in terms of once you indicate, in order, as I said, for balance, we have the government, a couple of the government members, and then we come to you, like that, so that you are able to, and you are free to go back and refer to any comment made from the government side at any point in time.
So could Your Honor please indicate to me at what point you are going to allow me to respond to the honorable member's first question?
Which honorable member's first question?
Honorable member for
But no,
St.
the
Michael
question
South
is not
East.
for you. The question is for the persons in the well honorable
And
member. If you want to comment on it, you can comment at your intervention.
No, I'm not commenting. I was told that I may intervene. I went into the public domain. I hope you can hear me, sir. The Attorney General doesn't like you to hear me. But I was told, would you like to hear me, sir?
But I would like you to speak, because honorable member, I'm moving by the rules of, I'm moving by what the rules of the House say. I don't know who you had your conversation with, but I have to operate based on what the rules have said.
So you are saying to me, sir, that the only thing I can do in here today is ask 3 questions. Is that what you're saying to me, sir?
That is not what I'm saying. That is not what I'm saying.
I need this clarified.
I just clearly said to you, your questions have to be directed at the minister, and the minister and his team, because that is the team in the well. It cannot be directed to a member.
No, it is not directed to the minister. It arises as a result of the minister's question.
Mr. Chairman, I believe that the Honourable Leader of the Opposition has somewhere to go, and he's trying to therefore usurp his powers by trying to jump ahead of the queue. But all of us have the opportunity to ask questions and come back in throughout the entire day. Please let us move on. This is too serious a debate for us to be wasting time.
Honourable Leader of the Opposition, the question be posed to the minister. The question can be posed to the minister.
To the minister, yes, Your Honor. Not to the honorable member who
in
asked
the well.
it. No, to the minister, sir. And it arises out of a question the honorable member for St. Michael South East asked. And I understand that to be the procedure that may be employed in here. The long and short of this, sir, is that they don't wish to hear me.
I will come to
And
you,
I would ask you to
I will
defy
come to
them.
you, Honourable Leader of the Opposition. Honourable Member for St. Michael West.
Thank you, Chair. I'm blessed and thankful for you to allow me to intervene at this time. Good morning, ministers and team. First and foremost, I would like to commend the Ministry of Health in its handling of the COVID-19 pandemic, specifically with the protecting of the Queen Elizabeth Hospital and allowing that institution to function at full capacity, pretty much, to attend to Barbadians and to other individuals around the region. And I am sure that the amalgamation of the chairman position, the CEO, into the executive chair position allowed that institution to be able to be successful at that time. That is a policy that obviously allowed the QEH to be nimble. And I go on from there to say that it is obvious to me that the divorce of those two entities is necessary at this time to face other challenges which have been stipulated by the Honourable Minister, such as NCDs. So I support you 1,000%, Honourable Ministers, in you seeking to tweak the administration to be able to meet the challenges of the day. Now, to go to my first question, I would like to bring to the attention of the House an esteemed individual by the name of Dr. Patricia Bath. She is a lady who led the Jules Stein Eye Institute in California. I was the first female researcher there. Her field was ophthalmology. And in her work, she concentrated on vulnerable communities. And the vulnerable communities were dominated by African Americans. And what she found was individuals of African heritage were 8 times more likely to be afflicted with glaucoma over that of the population. In addition to that, there was a lot of misinformation and miseducation as it pertains to cataracts. And I could tell you from canvassing in my constituency that a lot of individuals are very confused about the nature of a cataract. Some people believe that it cannot be cured, that they're blinded forever. So what Dr. Bath did is that she basically invented community-based ophthalmology. So my first question to you, Honourable Ministers and team, is that we know of the challenges in the hospital as it pertains to the waiting list. And this waiting list is twofold. One, the waiting list is for cataract surgery. And two, the waiting list is just to be seen. And we know that with glaucoma, it is a ticking time bomb. And if you do not get the proper treatment there, and I have many constituents that have missed the timeline and subsequently had issues after that. They had to go, and when they could have been getting laser surgery, they have missed that window. So I'm concerned about those two waiting lists and what it does to our citizens. Can you tell Barbadians what is the plan to alleviate this list?
Thank you, Honourable Member. It is a difficult issue. The issue of screening Barbadians as it relates to glaucoma and cataracts. The point is being made. One requires surgery, and oftentimes people feel that there's some surgery is required for cataract. Once you've been told you have cataract, you should have surgery, and that is not the case. And similarly, we are concerned about glaucoma and its relationship also with diabetes in our country. The ophthalmologists have, the association have from time to time done public screenings, and I think sometimes once or twice a year they do this. But as relates to the QEH, it is just a battle. We have a number of ophthalmologists there, you know that, but you also know that cataract is quite common in our country, in our society. And oftentimes, glaucoma is being picked up too late. People are not getting their eye screening, their eye testing done routinely and as frequently as they should. We have tried in the public sector, because there's some work being done at Winston Scott Polyclinic, and one of the ophthalmologists at the QH, I can call his name, I don't want to call his name, has been very useful in this regard. But it is something that I think we were speaking, and one of the doctors in Dr. Kamabach was speaking that we needed to do more in terms of outreach to the public in relation to particularly cataracts and glaucoma. But it is something that we need to sit down with the ophthalmologists and work on. And I know that you have a similar clinic in your constituency, which is very good. And perhaps we need to get together some more additional ophthalmologists, and it can be something where, organized by the ministry, not put everything on the QEH, where we can get together with ophthalmologists in the private sector and see how we can work out a process of, trying to address these matters earlier. As relates to you're correct, the long waits for appointments. Sometimes people often call you, but they have been referred to the eye department, and they have to wait 4 months, 6 months. That is not good enough, and it's something that we need to address. The CEO did some excellent work in terms of the backlog for cataract surgery. And I think similarly now we have to look at the clinic appointments and see how we can do that. If you have to bring in more part-time doctors, ophthalmologists, I know a lot of them out there who are willing to come and work part-time, but it's certainly something that the QH has to look at addressing, the appointment system for ophthalmology. I don't know if Mr. Harris wants to, as Director of Medical Services, wants to speak to it.
Anthony Harris, Director of Medical Services. Sir, Your Honor, the Honourable Member posed a very important question, and something that we are certainly concerned about. And a number of strategies is devised to tackle this. The House may not be aware, but the ophthalmology department has really decentralized, and we're able to provide in the polyclinic system with a view of expanding it as well from the Sir Winston Scott Polyclinic into other polyclinics where we would be seeing patients and doing the screening tests necessary to detect cataract and glaucoma. This we think is very important. Part of the problem that we face at the hospital in terms of the wait list is the facility to have the number of operating theaters. We have a single operating theater serving 9 specialists. And certainly my worry is that we are not giving our specialists enough operating time to practice their art and to get the numbers down. But I do know that at the Queen Elizabeth Hospital, we are considering, or we will be looking at bringing the 3 operating theaters in the Lands Eye Care Center back into service. This would have the ability to almost triple, if not quadruple, our output of eye surgeries, both for glaucoma and cataracts, and therefore we'll be able to get the numbers down. But even besides that, we do come up with strategies of setting targets of numbers of cases to be done monthly. And when there is no obstacle, our ophthalmologists have been able to reach these targets.
Mr. Chair, the CMO wants to speak.
Good morning, Kenneth George, Chief Medical Officer. Chairman, I would just like to do a bit of follow-up. We believe that from a public health perspective, we need to have a preventative eye care program for children. And we have an eye care committee which is extremely active. It consists of ophthalmologists from the Queen Elizabeth Hospital, persons who are trained in refractory errors, and the broader public health team. What we are doing at the moment is expanding our early detection and preventative services to 5 to 11-year-olds. We have gotten good cooperation from the Queen Elizabeth Hospital and the ophthalmology department. So we will continue to make sure that while we look at the cataracts and the glaucoma, which tends to be downstream, we need to have an active program that promotes good eye health within younger persons in Barbados. So we will continue along that vein. Thank you.
Just as a follow-up, so with the 3 operating theaters, that will obviously make a huge dent in the list, but would those 3 operating theaters be outfitted with individual phaco machines?
Anthony Harris, again. With respect to your question, if they would be outfitted, these are really 3 purpose-built operating theaters in the Lands Eye Care for ophthalmic surgery. Of course, when those theaters are refurbished, they'll be fully outfitted with all the necessary equipment to perform all levels of eye surgery.
Okay, that is very encouraging to hear. So for my next question, I was really going to tackle women's health with breast cancer, but the Honourable member from St. Michael Southeast did a really good job, and obviously bringing a personal perspective is very important. The only thing that I would say other than that is that given that, again, women of African heritage are more likely to contract breast cancer, and also a more invasive form of breast cancer, and at a younger age. So, Minister, to your point about screening, I think that obviously is hugely important. And given that breast cancer is more likely at a younger age in Black women, then is there a plan for the ministry to change the guidelines of screening? Because right now, even if you were to go to the Cancer Society, and they do an excellent job, and you're 35, they would tell you, we ain't screening you because you're too young. But then we hear heart-wrenching stories of young women who, unfortunately, because of the higher risk profile that we tend to have in Barbados and the Caribbean, they get treated at a later stage, as the Honourable Member said earlier, which then, obviously, with the lack of pertinent equipment, such as the linear accelerator, and I'm very glad to hear that that will be procured soon. So with that in mind, have you looked at tweaking the guidelines which meet our specific cultural needs in the Caribbean and in Barbados?
You're correct, and when I spoke earlier, I did mention that we are, in addition to dealing with colon cancer, we are also looking at the protocols and probably modifying the protocols for breast cancer, and of course prostate cancer, which is always the one that is debatable. But your point, I agree with you, as it relates to breast cancer in our population. The tendency is for it to be more aggressive, but also oftentimes it is extremely small. There might just be a solitary, very small lump. And already you've had micrometastases and it has spread already. So we need definitely to change those protocols. And Dr. Arthur Phillips is working in conjunction with his committee on these protocols. And it comes out of a proposal, the Cancer Project, which was approved in 2020 but I don't believe that we've moved with we've moved fast enough on this. I guess COVID was there. But we are now focusing certainly on this whole issue of cancer awareness, cancer prevention, cancer screening. I don't know if there's anything you want to add. And ask Dr. Phillips to add on. Thank you. But it is something to mind.
Sure. Arthur Phillips, Deputy CMO, NCD Focal Point. In terms of breast cancer screening, we have commissioned a group that is looking at updating our guidelines, taking into account not just the international evidence, but the local experience. So we have colleagues from sort of the academic setting as well as the clinical setting with relevant expertise in terms of management and screening of breast cancer that is going to deliver the guidelines for us so that we are better able to have locally appropriate guidance, up-to-date guidance on early detection and management. Additionally, Senior Minister would have mentioned the messaging. So we've devised cancer risk reduction messaging across, or particularly concentrating on the most common cancers. So there's generic messaging for cancers generally, as well as specific messaging, which includes issues around screening. So that's going to be rolled out in the new financial year. Thank you.
Thank you. I think that's encouraging, because I know that in the developed world, especially the USA, which is used as a gauge for 5-year survival rates in breast cancer, are like 99%. And Barbados currently is one of the highest in the region for mortality. So we really have to look at that, especially since we have the mission of becoming world class. So that is very encouraging to hear that that is high on your agenda.
But we are still picking up these cancers too late.
Yeah.
Regrettably.
All right. For my last question, a bit of a personal note. My mother has been afflicted with multiple sclerosis for 29 years. So I'm no stranger to A&E. Actually, last time I went there would have been when A&E first opened, right after the passing of Elsa. So I would have been with her to A&E on the Saturday after it passed, when, as you know, the generator wasn't fully kicking in, and it was partially dark, and only, I guess, critical machinery was attached. In that experience, I would say that she presented with a lot of red flags. So she had low SpO2 levels and, very concerning things. And we were admitted in and everything, but unfortunately, we were in there for 8 hours. We saw a junior doctor at first who collapsed during taking her information. So apparently she was working long hours or something like that. So we waited patiently for another, but another never came. So at that point, I was forced to pull a string. So I called my cousin, who was a consultant internist, and she managed my mother from there. Now, obviously, most Bajans don't have the ability to do so. And you hear about these stories about people in A&E who have had some nightmare stories. Now, that's not to say that I haven't had some good experiences, because in tertiary multiple sclerosis, you encounter a lot of seizures. So I'm always in A&E with her. And there were times when we had excellent service. So clearly, there needs to be work administratively on delivering consistent quality of service in the A&E. So my question to you, how do we get there? That we can consistently serve Barbadians to a level that is dignified, and that they don't have to have the experience of waiting for hours, sometimes days, I hear.
Thank you, Mr. Chairman. I have 5 minutes. The A&E, I cut straight to the chase. The concerns and the complaints are not at all not acceptable. And we need to, certainly that is the number one priority in the creation, indeed the Ministry of Health, the A&E. And I'm going to flash through a number of things quickly. There's the expansion of the A&E, first of all. That is going on. That is to be completed shortly. So we will have, I'm told, roughly twice, double the space for patients. It has to be outfitted with a lot of equipment, and new equipment. There's even plans for a CT scan to be there, because oftentimes the complaint is that persons who need to be assessed and treated, especially people who are having strokes, where you have to make a determination if they can benefit from certain treatment to stop that stroke, or even to reduce the effects of the stroke, you need a CAT scan. And oftentimes we miss the time, the cutoff 4-hour time in getting those persons assessed. So equipment's gonna be done. There are plans to increase the staff, nursing, doctors. I think you've probably heard me already. I've spoken about the need to have in A&E, when we're recruiting additional doctors, doctors who are trained in emergency medicine, who can see people. The encounter that you said with you had a junior doctor who collapsed or fainted. I mean, even if that person hadn't collapsed or fainted, as a junior doctor, oftentimes they would see her and assess her and then have to refer her to someone who is senior or who is more, who is a consultant or whatever. So that needs to be addressed as it relates to this type of medical staff you have there. It is a training hospital. You will have people who need to be trained, but we need to focus more on people who can hit the ground running, who are A&E trained and who are specialized in A&E. The attitudes. This is something that you hear repeatedly. And over the years, a number of things have been tried. They've tried patient advocates, people who are supposed to go outside and interact with the people and make their relatives feel comfortable. This is often done in theory and not necessarily in practice. We've had discussions about bringing in NTI to do a training of people in terms of customer relations, patient relations, and also for all categories of staff, because, and I've had, it's not popular, but I've had discussions with the dean of the medical faculty and the people, that even in training, we need to start bringing back in these softer skills in regards of nursing training or medical training, how you interact with patients, how you speak to them, how you speak to their relatives, because these are things that we are losing or have lost in generally here in our system. And we need to, inculcate these back into the training of these health professionals. And indeed in a hospital, all categories of persons should have these skills, how you relate, can they help you, if somebody is in pain, reach out to them. So it is an area that is going to be addressed. It is not going to happen overnight. You're not going to have this transformation in attitude and behavior overnight. Having said that, the vast majority of people do, treat the patients and their relatives. But in anything, you just have to have the wrong people meeting the family whose relative is very ill and they're very concerned. But I take your point, it is an area that I know we have to address in the QH. And I think the management and the board have already heard that from me more than once. Thank you.
Thank you.
Thank you very much, Your Honor. I take it that you will now entertain my intervention in response to the Honourable Member for St. Michael Southeast.
Honourable Member, please give the chair the opportunity to chair.
I don't want the Honourable Member's intervention to become too distant a memory for you. And so that it remains fresh in the minister's mind.
Honourable Member, I now move to the Honourable Leader of Government Business.
Thank you, Mr. Chairman. I beg to move that you do now report progress to His Honor the Speaker and beg leave to sit again.
The question is that I do now report progress to his to her honor the Deputy Speaker and ask for leave to sit again. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it.
Honourable members, the chairman has reported progress and has asked to leave and sit again. Madam.
Thank you, Madam Deputy Speaker. I beg to move the suspension of the House until 5 minutes past 12.
The question is that this sitting is suspended for 5 minutes, 10 minutes. Honourable members in favor, please say aye. Those against, please say no. I think the ayes have it. This chamber is now suspended until 5 minutes past 12. Honourable members, this sitting is resumed. At the suspension, we were in Standing and Finance Committee, and to that we shall revert.
Honourable Leader of the Opposition.
I'm obliged to you, sir. And this question is for the senior minister, not the junior. I hope they allow you to say something today so that we wouldn't think you're a mannequin. Minister, on 2 occasions, the honourable member for St. Michael South East sought to dismiss the importance of this matter of excluding Barbadians and Caribbean people from consideration for the post of CEO. And although the honourable member dismissed its importance,
Mr. Chairman, the honourable member is leading the House, and knowingly so. I did not make any such suggestion. I've indicated that I felt that this is an important debate and one which we needed to get to the meat of the matter in relation to the issues concerning the people of this country, but more importantly, that the hospital has to put itself in a position to manage, and we're not discriminating against any Barbadian. There's a process, it's been explained, and the honourable member would do well to have listened to what the minister said and to his team in relation to that process.
Thank you. Not only did I listen, but I wrote down what the honourable member said in relation to the hiring of an Englishman, and I refer to nationality and not race. I don't do that. I refer to nationality. Now, to the minister, I am raising this question. The honourable member for St. Michael South East sought to justify the hiring of an Englishman. I don't even know what race the gentleman is. I haven't seen him. They're black people who live in England. They're Indians who live in England. One happens to be the Prime Minister. So the question of race was never raised.
Mr. Chairman, the honourable member is misleading the House. I'm not here to justify the hiring of anyone. Perhaps he needs his own justification for the position he now holds, but I'm not here to justify anybody at the hospital. I have simply made the point that the hospital has to do what the hospital has to do to transform, and the honourable member would do well to stick to what the purpose of this debate is for. Ask his questions.
I will ask the question. Now, I understand the honourable member's disquietude because the other part of the duumvirate is here, and she's upset. The honourable member is upset about that. In fact, you would recall, sir, that the honourable member said that she was not scheduled to answer questions, but she just wanted to get at this minister early. I understand the disquietude.
Mr. Chairman, I will not allow the record to be tainted by the Honourable Leader of the Opposition or to discredit me in any way. I am not after the Honourable Minister of Health, and he knows that. I am here to raise the issues of the people of this country, just as you are, Honourable Leader.
Yes. Well, look, accept that it is a
Or so you say, so you say. And I think that comment ought to be struck from the record, as should the others.
Accept that it is a duumvirate in this country and not a triumvirate. And that this minister is part of the duumvirate.
Honourable Leader of the Opposition.
He has more power than all of you.
Honourable Leader of the Opposition, this debate is about health issues on the Ministry of Health. It is not about who has power, who doesn't have power. Please ask your question and utilize the time that you've been given wisely, the time that you asked for.
I'm being
and you are allowed.
On the question of power.
He doesn't have power, that's why he's behaving like this.
I'm obliged to you, sir. Minister, the honourable member for St. Michael South East, I wrote down what that honorable member said in relation to the justification of the hiring of a CEO from the North Atlantic. Here is what was said. We have to look for the best minds and the best people. Check YouTube and you'll see. That is what was said. We have to look for the best minds. And please stop interrupting me. You came late, dressed as you are.
Honorable Leader of the Opposition, we have spoken already with respect to your exchanges across the floor.
But I'm speaking and he's shouting at me.
Honorable Member, who is he? You cannot refer to members that way.
The Honorable Member shouted at me.
Honorable Member, proceed with your question.
Please
and let
show him
the
Rule
House
33,
go
sir.
on.
Please show him Rule 33.
I will show you Rule 67.3.
Yes, Minister. And I'm serious. The Honorable Member for St. Michael South East sought to justify the hiring of the gentleman on the basis of this statement. We have to look for the best minds and the best people. Minister, you are aware that a gentleman came here to head BTMI, and in the time he was here, he tried to say as little as possible to Barbadians and succeeded. He left here, nobody knows his position on anything. So now we have somebody who is described as the best mind and the best people. My simple question to you, Minister, do you adopt that statement as your own justification for the hiring of the gentleman? That I'm asking you, if you place him within the category, within the human category, to the exclusion of young Barbadians and young Caribbean people, do you place him in the category of the best minds and the best people? Simple question.
I didn't, Mr. Honorable Member, I didn't hear the comment to which you referred. I don't recall hearing this. I certainly didn't make any comment about best minds. The chairman who outlined the process made no such comment.
Yes.
So I can't associate myself.
You cannot
with what
associate
you're
with it,
saying.
you disavow it. I thank you. That's all, sir.
That's your question, Honorable Member?
My intervention in response to the Honorable Member for Southeast. I believe I still reserve my 3 questions when the time comes, when you so call on me.
Honorable Member, that is why I've come to you, because you asked so that we are fair and there's balance. You heard me respond to fairness and balance. I'm not going to do, unless you're asking me to do all government members and then come to you, and that will not be the case. So I'm giving you the opportunity, one of the opportunities that you will have at this time to ask your question.
No, I'm not ready. I'm not ready with my 3 questions yet, sir. So please go to the other, sir. And I know you're tired of hearing, I agree.
One honorable member, I am happy that this is one time you get to direct the chair.
I beg your pardon, sir.
Honorable member for Christchurch West.
Thank you very much, Mr. Chairman. Clearly, from everything that we've heard today, it is absolutely obvious to all those listening that health is a very personal matter. And it goes to the heart of everybody's well-being. As you heard the Deputy Prime Minister relate to her own personal experiences, and as you heard the member for St. Michael West, who also related to his personal experiences. And clearly it shows how important the Ministry of Health is, not only to people in their personal capacity, but also for the country as well. Indeed, it could also be measured by how much money the government spends. In this estimate, some $370 million. One of the, I think the largest or the second largest head that we will be doing today. And obviously why we've extended the time. So health is an extremely important head for which the whole country has a say, a part, and obviously a benefit. My first question Minister, has to do with the expansion plans. And I heard you say that you have $130 million for infrastructure expansion. And I would want you to expand on your expansion plans and share for the benefit of the country what those expansion plans will be, in particular the ones that you want to do over at the Enmore site.
Thank you, Honourable Member. Immediately, the 130 million I mentioned was for CapEx, which is obviously equipment and some infrastructure work in the hospital. I think members might be aware that there has been discussion about expansion of the QEH facility into our campus. We've had issues currently with the laboratory and issues of administration, crowding, and need to expand in the original building. A decision was being made to expand the facility. We're looking at the Enmore site, and as a matter of fact, 3 weeks ago it was that there was a request for information was published in the daily newspaper here, seeking persons who might be interested in undertaking this process. It speaks to a 3 and 4 story expansion. It speaks to a car park facility. If I may go through the various components. You heard me mention earlier concerns about cancer. In those plans, the construction of an oncology center, oncology unit, with linear accelerator, PET scan, the various treatment center areas for chemotherapy treatment, areas for education and discussions, as the Honourable Member from St. Michael's Office spoke about earlier. Also a new lab, and up to date, and this is not to be confused with the Best of Santos lab, which is a public health lab, and I'm looking at a hospital lab, dedicated lab. There's provision made in there for administration, the various administrative offices, and also for outpatients clinics. In addition, there is provision now being made for a rehabilitation center, because it is something that Barbados needs. We have the issues not only of diabetics and amputees, but we're having increasing trauma, be it human on human or vehicular trauma, and you're having younger people who are affected and afflicted. And thought it is time that we had a rehabilitation center for this island, and obviously the people who suffer strokes, etc. So there's provision for that. Car park facilities for the hospital. This has always been an issue. You see people parking all around the area in unsatisfactory and unsafe areas sometimes. And this is to be linked to the hospital by a bridge. That is a proposal from oncology department. There's a bridge that would go across. This is at very early embryonic stages now. I believe there are some initial drawings, etc. And it is a project that the government is looking to get going and get completed probably within the next 2.5 years. This is what I can say on it at this point in time. I wouldn't go in for obvious reasons. I just said we had requests for information. I wouldn't want to go into details here in terms of proposals and the costs, but there is definitely a plan to expand the QEH across into the Enmore area.
Thank you. Thank you very much, Minister. Clearly, that would then, by moving those services out of the hospital itself, then that will obviously give then more opportunities for clinical space within the confines of the Queen Elizabeth Hospital itself as you move more administrative services out of the hospital. I don't know if you want to expand on that.
That is the plan, certainly. There's congestion, we need more space, certainly engineering. They complain about the crowded space there. We also need, as you said, more clinical space. We can expand the clinics that are over there still. And then the matters of expanding stores and stuff like this. And obviously, we are looking at the possibility thereafter of having some additional wards.
Thank you very much, Minister. My second question has to do with information technology and the upgrade of the information technology. You may recall that some estimates ago, I brought up this concept of being able to track how stock is used. And certainly in first world countries, they have barcoded everything as a patient is given a particular medication. You scan the patient's armband, which has a barcode. You scan the medication, and you track not only the medication that is given to that patient, but also the stock levels of medication. As you know, expiry on medication and drugs is a big issue for hospitals and for pharmacies across the health spectrum. And that is one way of tracking what patients are given, which patients are given, how much medication the patient are given, and to track stock levels. So, and I know I haven't seen that at the hospital. I asked about it several times, and I'm going to ask what progress has been made in terms of upgrading the information technology, and in particular, this opportunity to track what medications are given to patients, and then by extension, the stock levels of medications throughout the hospital and all the service.
Thank you, Honourable Member. It is certainly a matter that we have been meeting about and want to address, I'm told, within this year. But I think that we will certainly give it a good shot this year. But I'm going to ask my colleague, Minister Davidson Ishmael, to speak on this matter because he has oversight of this area. And perhaps afterwards, Director Louise Bob.
Thank you, Senior Minister, and thank you, Honourable Member, for the question. You reflected on how long this has been going on, and it brought to my mind the fact that the QH is celebrating 60 years this year. As an institution, the role of ICT across many institutions across Barbados cannot be understated, the important role of ICT, and the QH is no different. Technology has a very critical role to play in the administration and the execution and the delivery of healthcare services. So in addition to the specific question you've asked, which we will have Director Bob answer, there has been an overall effort to upgrade and enhance the ICT infrastructure at the Queen Elizabeth Hospital. Of course, members of the public, members of the House would be aware that the government of Barbados is in receipt of and has signed off on a grant in the total of just over 4 million euros, specifically to upgrade the QH's ICT infrastructure. That is to help with its digitization and its digitalization of its services. Critical and core to this entire rollout and the development of this digitization effort is a health information system, which, as you rightly stated, will allow for doctors, clinical staff, doctors, nurses, etc., as they administer patient care, to do so more efficiently, to be able to do so with the use of devices and technology that would allow for patient tracking to take place, to allow for the monitoring of patients, and not only diagnoses, but all the way through to their treatment and all the way through to pharmacy, and how those stores then are utilized throughout the infrastructure of the hospital. There's been quite a bit of work that has already been done relative to this particular project, this QH IT upgrade project. We have already established a project team. That is a 4-person team, a project coordinator, a procurement officer, we have a clinical specialist and lead, and we also have a business analyst who have already hit the ground running to help the QH to be able to do an effective needs assessment, department by department, identifying the technologies and the processes that are already in play and in existence, and to see how they can then map and re-engineer those processes so that technology can play a more prominent role and can help the hospital to obviously be more effective in its delivery of its services. This is a 30-month project, and we're well underway in that regard, and we're expecting that, and things are on track relative to the rollout of that. New computer systems in terms of hardware are being procured. You would hear from, and I'll probably ask, in addition to Director Bob, I will ask the Director of the Management Information Systems, Mr. Bushell, to also come and to speak relative to the more technical upgrades that are already underway and taking place within the hospital, and I'll let them to give a more fulsome expansion on what it is that we're doing. There was, as members would recall, there were some incidents, cybersecurity incidents at the hospital back in 2022, and I must report to this House and to the public that since that incident, there has been significant work done to improve the infrastructure, the ICT infrastructure at the hospital. Members would recall that there were some disruptions of services at that time, and I can confirm that all services have been restored a long time from today's date, but just to confirm that all services have been restored, and not only restored, but have been enhanced and improved significantly. So the cybersecurity infrastructure, the monitoring tools, the detection tools, and of course our response mechanisms have all been enhanced so that we are able to better prepare for any further incidents or future incidents that may take place. So there's been an overall expansion of, yes please, there's been an overall expansion of the ICT platform, understanding that it's going to play a critical role in what we're doing. The health information system is going to allow for all of the various departments at the QH to be able to speak to each other and to interact with each other in a more effective way, so that a patient coming through the A&E, all the way through to the ward, all the way through to discharge, is able to be tracked electronically throughout the system. So I'll stop there at this point in time, not to use up too much of the time, and allow Director Bob to come in, and then she'll be followed by Mr. Bushell, who is the Director, the Manager of Information Systems.
Good morning, Your Honor. My name is Louise Bob. I'm the Director of Support Services at the Queen Elizabeth Hospital. And just to expand on what Minister Ishmael has been speaking about with respect to the progress that we're making with the digital transformation of the hospital, we are well advanced in the core works team in gathering the information required for us to understand what our business and functional requirements are for this type of technology. And we are expecting in very short time we will be able to ascertain what solution best suits the hospital and what provider would be able to provide the technology for that is associated with the health information system. The modules that we're looking at entail the actual electronic health record, and the idea is to make sure that whatever solution is found is interoperable with the rest of the health sector, both public and private, as we progress in that area. Other modules include the admission, discharge, and transfer system. We're also looking at a patient billing and costing system, the lab system, and an HRIS, which will be not necessarily a part of an HIS, but whatever HRIS we come up with must be interoperable and be able to speak to the HIS. And then there are the clinical order entries and pharmacy supply chain management modules. But along with this major direction that is being taken, we are also looking at other opportunities where technology enhances the operations of the hospital and the patient experience. So for example, some of the accessories that will go along with the health information system is the patient portal. I mean, this is 2024, and we would expect that at this time, individuals subject to the rules and conditions of legislation surrounding data protection should be able to access their own information remotely. So that is one of the major advances that we expect to come out of this exercise. I'll turn over now to our Director of Information Systems at the hospital for him to speak a little bit more of some of the other technology that will be complementary to this advancement in health information systems.
Good morning, Your Honor. My name is Hadley Bushell. I'm the Manager Information Systems at QEH. In addition to what Director Bob has indicated, the project also will look at the supportive enabling environment for the hospital information system. And so therefore, we'll be looking at the Wi-Fi infrastructure, our wired infrastructure, to ensure that we have coverage to all the key areas that need to be, that the hospital information system will need to interact with. Also, we will be looking at also technologies, tracking technologies like RFID. We'll be seeking to do the groundwork to introduce such technology in our environment. As we see the utility of this technology as it relates to inventory management, asset tracking, and also it can have utility in relation to patient tracking as well, and also medication management. So those are the kinds of things that we're looking at currently. Thank you.
Thank you, Minister. However, you've now prompted me to ask a supplementary question to my second question. And it is clearly an important part of that must be digitization of records. And because even although we treat patients from present, it is always a benefit in arriving at the correct diagnosis to know what the history has been. And access to history and good historical records is very important. I am aware, well aware, that digitization of x-rays and ECG runs and things like that is technical, complicated, and vast in terms of utilization of space on a server or whatever. So the question I'm asking is, how far along is the hospital or the ministry with its digitization? Because as you know, the push for the whole government is for us to move to digitization, a digitized platform. And I am aware that you may have records which you are mandated to keep for many years in rooms that may be bigger than this chamber or cumulatively. So I think you should give us an update as to where you are on digitization and when do you think you can actually move to a situation where going forward, patient number one would be totally digitized?
Thank you. I'll ask Minister Ishmael again to speak.
Yeah, thank you again, Honourable Member, for the question. As a part of the overall digitization and digitalization process with the health information system, will be the digitization of records. Now, the hospital, just like many other institutions in government, have already sought to engage and embark on the digitization effort, albeit in a very small way, in a very small scale. Now, once we have a health information system identified, where all of that information is going to feed into, which is the medical record of each patient, etc., then we will be able to have a more robust effort relative to the digitization of those very old records, as you would have mentioned, patient records. I would allow Director Bob to come back in to speak more towards this, but just to let you know that digitization is a very important part to digitalization. So once we have the platform that is in place, then we can have the records that go into that system. And it is important to ensure that we select the right health information system that would allow us to then be able to digitize smoothly for whatever period of time backwards. As you rightly mentioned, there is data retention policies, which means that there are certain files that we have to keep for certain lengths of time. So we have to keep those things in mind. And that also then adds to the volume of data that would have to be digitized. So it is a lengthy process. This is not something that's going to happen overnight, but we understand that the most critical step in this process to have the health information system identified and procured, which is going to happen during the course of this year, this financial year. And that would allow us then to be able to have a special project that's developed to be able to do the digitization of those health records based on the retention policies of government and of course of the QEH. So I'll let Director Bob come in and she can also add some more technical detail to the digitization efforts already underway and what is planned as well.
There's not much more that I can add to Minister Ish.
On adding that as additional group of area of surgery that we can perhaps get into. But I'll ask the Chief Medical Officer, who has direct responsibility for this, to speak a bit more.
Thank you so much, Kenneth George, CMO. Let me make a general comment first. The Ministry of Health has not been able to attract dentists to the public sector. That's a fact. If you look at the information I have to hand, 95% of the dentists in Barbados are attracted to the private sector. There's not much incentive for them to come to the public sector. What we have done, fortunately, there were 5 sessional posts that were created. I'm aware that 3 of those 5 sessional posts are filled, and therefore we are able to offer a better service. But as the minister has indicated, all polyclinics are not up and running. We still have significant challenges with respect to our human resources to cover all the clinics. And we will continue to work with the private sector. The only solution out of this quagmire is to have all the posts filled. There's a post of senior dental officer and 2 dental officers. I think only 1 of the dental officer posts have been filled at this point in time, and making sure that we have the 5 sectional dental posts all filled to give a basic set of services. With these services, though, we will still only be able to concentrate on children and obviously emergencies in adults. We don't offer some services. We don't offer services like we offer very basic extraction, etc., but we don't offer reconstructive type services in dentistry in Barbados in the public sector. I hope this helps.
And of course, my follow-up question then, oh, someone else is going to, oh, sorry, Dr. Harris, Mr. Harris, sorry.
Anthony Harris, Director of Medical Services. We remain committed to providing operating space to the dental surgeon from the Ministry of Health. As Dr. George alluded to earlier, that position is a little nebulous at this time, but he certainly have access to the provision of dental services, particularly for children, at the Queen Elizabeth Hospital on Thursday morning, once a month. And as we said, when we can get all of our theaters in service, that we should be able to expand that availability even further.
Thank you, Mr. Harris. Of course, that brings on then my follow-up question, because in the past, we used to have a lot of dental therapists who would have provided a lot of services for children especially, which supplemented the service very well, and they worked very well together with the practitioners. And I know with the closure of the school in Jamaica, then that has put significant strain on the service. Have you been able to find anybody or any school that's willing to train other dental therapists to be able to add and supplement the service?
Thank you. You're correct with the closure of the school in Jamaica that has put strain on us. But I know that the senior dental officer was trying to get persons overseas to explore other avenues. In the interim, I was approached about a possibility, I'm going to be very cagey and guarded, of having the person who was involved in the school in Jamaica, there might be a possibility of getting her, encouraging her to come and live and work in Barbados and establish a facility. I haven't told the Minister of Education yet, but through Barbados Community College, where we could have our own little school here under her, because she was involved in running the one in Jamaica, and not only train Barbadians in dental therapy, but also have, make it profitable for BCC by offering training also to persons from the OECS. But that is something that I am working on quietly. Not so quietly now.
Thank you very much, Minister. Clearly, the Ministry of Health continues to be integral to Barbadian life and Barbadian society, and I commend you on how you've been able to take charge of the ministry and to continue the good work of the Ministry of Health. Mr. Chairman, with those few words, I yield back to you. Thank you.
Thank you, Honourable Member. Honourable Member for St. Andrew.
Thank you, Mr. Chair. Interestingly enough, my first question was related to infrastructure development and also dental upgrades. I was still asked it. You alluded to infrastructural work and some civil works going on at the QH, but my question is whether any of this infrastructural improvement will extend into those rural parishes. Certainly in St. Joseph and St. Andrew would have seen and enjoyed the benefits of infrastructural development over the last 2 years of their outpatient clinics. But I'm curious as to whether in your plans, if you plan to put a bit more effort into expanding healthcare into those rural parishes where there are limited options in terms of private practice. St. Andrew, for example, has no private practice at all. We only have access to one facility we have in parish, which brings me to my main question also, which is, are there any resources, any resources in the estimates this year for the St. Andrew outpatient clinic, which for the past 2 years has been functioning for only 2 days in the week, on Mondays and on Wednesdays, and even in those days, it has not been open for an entire day in some cases. And this has been 2 years that I've been asking for that facility to be open at least 5 days a week, like most other clinics. So are there any funds, A, for the enhancement or upgrading of some of these rural healthcare facilities? And B, if there are any funds available for staffing, I believe it was a staffing issue a few years ago, for staffing the facility in St. Andrew. I believe the same obtains for the facility in St. Joseph. I don't believe anything has changed for those 2 clinics which were recently opened. And also, we don't have any dental care. So since the Honourable Member mentioned it, are there any plans to also include in some of the rural parishes dental care facilities as well? That's my first question.
Thank you, Honourable Member. You've answered a number of questions. You said it's the first question. You started off with infrastructure, and I mentioned earlier, not in detail, about plans to do an entire refurbishment of all the polyclinics. And in that plan that we're looking at refurbishment of 7 polyclinics and rebuilding 2, the Randall Phillips and the Eunice Gibson. And we're looking to, as I said earlier, to a whole package to seeking funding to refurbish, expand, because there needs to be a renewed focus on primary health care in Barbados. I think some of it, we have drifted a bit in primary health care. We focus on the QEH, tertiary health care, which is important. But we also have to recognize that once we can identify the disease processes early on, we can make interventions earlier on, we can have better patient outcomes, and then certainly we can reduce the need for the QEH. If we pick up a number of these issues, these diseases, these concerns, these cancers early, then we don't necessarily have to, but we can ease the load on the QEH. So this is the plan. Meanwhile, there are plans, and I'll ask the technical officer to speak to it, to do works, renovations, roof repairs at a number of polyclinics. You keep speaking about rural polyclinics, and there's plan for work to be done at Randall Phillips. I don't know, you might not want to call that rural. St. Philip Polyclinic, David Thompson Polyclinic, the Morris Bayer Polyclinic. There's work plan for all of these. There's also work plan to do the long out of use St. Thomas Clinic, St. Thomas Clinic. As it relates to your specific request returning to the Belle Plaine Polyclinic, we've always seen these clinics as satellite clinics called the one in Gordon, St. Thomas, the one in Belle Plaine, and the one in Horse Hill. These have always been seen as satellite clinics, not full polyclinics. We recognized back then that we didn't have the resources, the nurses, the doctors to be there. In fact, your clinic gets serviced by nurses and doctors from Morris Bayer Polyclinic. And Eunice Gibson serves Horse Hill and St. Thomas when it was open. And we're breaking plans now to refurbish that. And the matter of resources is more than finance. We have a shortage of nurses. And right now, even in our polyclinics, we don't have enough nurses. And that's why we're using Ghanaian nurses, and we're looking to recruit more nurses. So I have no doubt once we get the nurses, then we can utilize them better. At the point in time, I can't see us offering 5 days at this point in time to Belle Plaine and to Horse Hill. We'll certainly make efforts to see if we can increase it by a day or so, but we need staff. That is the main issue. The dental clinics, we are struggling, as was stated earlier, in trying to find dental officers, dentists, to serve the ones that we have right now, the 9 polyclinics, the 7 that we have where we have dental offices. So that is also, it's a good idea, but it's certainly something that I can't see doing, certainly not in the next year. The third question? You asked 3 questions. I don't remember the third one. The last one you ended, can you repeat it for me if you don't mind?
I asked about the upgrades and I asked about the healthcare, and I asked about the time. You answered them.
I covered it, thank you.
Honourable member, if you
okay, my next question.
Hold your question till after lunch, sir. Honourable Leader of Government Business.
Thank you, Mr. Chairman. I beg to move that you do now report progress to His Honour the Speaker and beg leave to speak again.
The question is that I do not report leave to Her Honour the Deputy Speaker and beg for leave to sit again. All honourable members in favour, say aye. Honourable members against, say no. Methinks the ayes have it.
Honourable members, your chairman has reported progress and has asked for leave to sit again. Honourable member?
Thank you, Madam Deputy Speaker. I beg to move the suspension of the House until 2:15 p.m.
The question is that this House, this Honourable Chamber, be suspended until 2:15 p.m. Honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. This session is suspended until 2:15 p.m.